Almost always, the diagnosis of a valvular heart disease can be made with the help of a stethoscope and a good auscultation. However, to precisely determine the severity of involvement of a valve, we need further investigations like echocardiography and ECG. Echocardiography will tell you to what extent the aortic valve is stenosed and whether there is an additional leaking of the aortic valve or not, what is called as aortic regurgitation. Now, one of the most important things to remember here is that initially when the diagnosis is made, it is possible that the aortic valve disease is not very severe. But over a period of time, it is almost a rule that it will slowly progress over a period of few months to few years to few decades to a very severe aortic stenosis. When it develops, then some form of surgical intervention or non-surgical intervention will have to be performed to cure aortic stenosis. There are multiple options. When the disease is not very critical and the aortic valve has not become severely stenosed or narrow, we can give medical treatment, which usually includes a small dose of diuretic. In addition to that, when the aortic stenosis is not very critical, the best thing to do is to do a follow-up echocardiography every 6 monthly or 1 yearly. And subsequent to these follow-ups, when the aortic stenosis becomes very critical and the gradients across the aortic valve really start rising, that is the time either a surgical intervention will be needed or a transcatheter intervention will be needed. Now, there are certain drawbacks of surgical aortic valve replacement, which we are going to be seeing in the next video.